I'd like to introduce Dr. Brian Udell from Florida in the United States, who prescribes LDN for autism. Thank you for joining me, Brian.
Thank you for having me.
Could you tell us when you first heard about LDN?
Well, about 8 years ago, I was doing a clinic for the city for follow-up for children who are high risk for autism. And at that time, I was actually seeing 7 children a week. Now we're up to being able to see 10 children a day if I wanted to see that many.
Oh my
So
God.
it's obviously this epidemic was happening, and I really was quite frustrated that the general medical community had very little to help these kids. That they and even today they get a ticket for, various therapies. And the best the doctor can say is, do your best. They can't really give any odds on how the child's going to develop if they have delayed speech and language. Typically, that's the problem is delayed speech and language and repetitive behaviors and social isolation are the sort of domains that have generally been accepted. Even they come and go on what the diagnosis involves. But anyway, I had very little to help the children with other than pretty strong drugs, either the stimulant-type medications or the central nervous system like serotonin medications. And looking through the PDR and through the literature, I found LDN, and almost my first patient that I gave it to had a positive response to it. So that's how I got it. It wasn't LDN at the time. It was Naltrexone, because I thought that it was a regular dose of 5 milligrams, I think, and the child he wasn't a child anymore. I think he was 12, and he was very combative, and it definitely helped his behaviors. So from there, I then started going. Actually, right now I'm at a conference in Los Angeles for autism, and I started going to these autism conferences and heard about more people who were trying different things for signs and symptoms of autism. And Dr. McCandless's study keeps coming up, and that was in 2006, where she discussed using it as a cream at nighttime. And since then, I think that I've been fairly successful using it because I try to make a clear diagnosis for the patient. So it does seem to work on the immune system, and the immune modulation does seem to. Some of my patients just take it because they say the kid stopped getting sick every year, and that would be the only reason they're even continuing it. And many of them have seen remarkable improvements. And in the negative side, if they don't like it after a few days, if they're too hyper, we can cut back, but nothing really in any way serious. So it was always something to try, and that's how I got into naltrexone and LDN.
Mm-hmm. How many children do you think you've treated now with LDN?
Well, since I started my own practice, I have treated about 1,000 children, and I would say probably 10%, 10 to 20%. One of the problems in our clinical practice right now is anyone who's getting funding for studies is very difficult, especially if there's no money in it. And naltrexone, as you know, people may know, is pretty inexpensive. And so there's not too much interest in doing a study, but so I don't have great statistics on my patients, but it's about I would say about 100 or 150, more like it. And I'm just pulling my statistics together for 2014, and I think 70 patients got it in 2014. I kept ramping up every year to the number of patients that would get it. So we're looking at about that number in that year.
Mm-hmm. And what would you say the success rate is, that 70%? Well, it's of the 70 patients who got it. Again, I'm looking at right now I'm pulling that data for the conference coming up, but it's probably about 20 or 25%.
So I know that I'm being very vague on the numbers because, again, I don't have, the kind of horsepower where I can keep these statistics. And it's certainly not anything like a study. It's in no way a study. On the other hand, when I feel like the child is showing repeated infections or, won't get better, and I've tried just about everything else for the immune system, and especially in those cases where the children have hyperactivity or aggressive behavior, the choices for the parents are limited. And so it's not like I keep great statistics about this. It's just my clinical sense is I don't have to go to the drugs as often, the hard drugs as often.
Mm-hmm. So what would you say to parents of children that have got autism? Is it something you would recommend they look into?
I think that the first thing is to get an accurate diagnosis, that autism is like saying somebody has cancer. And that there's going to turn out to be many different types of autisms. And so you have to get an accurate diagnosis. And for example, if you have a genetic type, it might be less likely to be helpful or more likely, but you want to get an accurate diagnosis. And then the second thing is to have a workup that sort of points to what the major problem is. Most of these children, every one of the children really, has some comorbidity, has something else going on in them that if you fix, for example, gastrointestinal problems, then you can fix the immune system a little bit, and you can fix downstream behavioral problems. And it doesn't seem like they all fit together, but our experience is that it certainly does clinically.
Mm-hmm. Well, that's very enlightening, and thank you very much for sharing your experience with us.
Well, I hope this helps, and I hope that parents do. That when they have their child has autism, that they do explore why their child has it, and don't just give up because conventional medicine only has drugs to treat, the bad symptoms.
Mm-hmm.
Thank you.
Thank you.